Hi, my name is Winnie Byanyima. I'm the Executive Director of UNAIDS. I'm delighted to welcome you to this conversation called Time for a People's Vaccine Against COVID-19, which we are hosting as part of this year's first virtual AIDS 2020 conference. A warm greeting to all our listeners across the world. I'm delighted to welcome my friend Patrick Gaspard, President of the Open Society Foundations. Welcome. OSF, Open Society Foundation, is the world's largest private funder of independent groups working for justice, democratic governance, and human rights. In May this year, UNAIDS was proud to co-lead an open letter signed by over 150 global leaders calling for a future vaccine against COVID-19 to be a people's vaccine, available for everyone, everywhere, for free. Patrick, you were one of the people who signed this letter, and I thank you for doing that and for joining me today in this conversation. Please say a few opening words to start our conversation.
Thank you so much, Winnie. Thank you for inviting me into dialogue. Thank you for your extraordinary leadership. Thank you to all the work that UNAIDS does every single day, but most especially in this moment of catastrophic pandemic that invites us all to be compelled to work in solidarity. Your call for a people's vaccine, the advocacy taken up by UNAIDS in this moment, successfully highlights the need for urgent global joint action with over 140 global leaders meeting your call, signing on, but also making certain that this call receives sustained media attention, sustained attention at the grassroots level and at the levels of government and at corporate entities as well. So thank you for all you've done on this front. This moment stresses the need for access anchored in justice and equality, which really is the framework that you and others have taken up in AIDS-based interventions as well, Winnie. I have a question for you, Winnie. I wonder if we should be at all concerned that the appropriate global fixation that we have now on COVID-19 might detract in any way from the response to HIV, which I know, of course, UNAIDS is central to. And so I wonder why UNAIDS in particular is leading on vaccine access to COVID-19 as opposed to keeping that focus on HIV exclusively.
Well, this pandemic, COVID-19, has taken lives, has destroyed livelihoods, is sinking economies. 10 million people infected so far, 500,000 deaths globally, all this in 6 months. ILO predicts that 300 million jobs will go. This is totally unprecedented. The pandemic highlights and worsens, keeps worsening existing inequalities. It doesn't spare anyone. We are part of the effort to fight back. But you are right, AIDS is not over. UNAIDS, we came out with our global report yesterday, and we show that there are 38 million people living with HIV, 25.5 are on treatment, 12.5 are still waiting. 690,000 people died last year of AIDS-related illnesses, and 1.7 million others were newly infected. So, we're not on track to end AIDS. Because we have been fighting AIDS for 40 years, we have an experience on fighting epidemics. There's no vaccine, no cure for HIV, but HIV has become a manageable treatment, a manageable illness because of treatments. In year 2000, there were treatments but costing $10,000 per person per year. By the following year, the price came down to $100 per person per year. And that was thanks to generic production in countries like Brazil and India. So let me say this, that we've learned so much from fighting HIV, both good and bad lessons, and we are in this fight to bring these lessons into fighting COVID. We can't afford to repeat the mistakes of the past, and we must build on the successes. 3 successes. 1, we proved that you need communities and global activism to lead a campaign to fight a disease like an epidemic. 2, what I just mentioned, generic competition was the most effective way to ensure supplies and prices coming down. And 3rd, you need global solidarity to fight a global epidemic. The world came together to create UNAIDS, to create Global Fund, to fight HIV/AIDS. We need global solidarity. Those are our 3 main lessons we bring. Then we also made mistakes. In 1996, treatments for HIV had been found, but it took another 10 years before people in poor countries, low income, middle income, could get on treatment. They were dying, but it took activism, global activism, to fight to bring the prices down. So we don't want people to die now as their countries wait in the queue while the rich ones stock up a vaccine. 2, we don't want this system of monopolies of intellectual property rights and pharma-leading production of essential medicines, vaccines, to remain. We want to change that so that the costs of research and development are separated from the price to people. So that is part of the reason we are in this, to see how we can use this crisis to change the rules so that in future, and look, the system has failed. Today it's public money that is funding the vaccine. So we want to make sure that these lessons are learned and the system changes so that we all have our right to health. And lastly, there's complacency on HIV. Because we got treatments and the disease is manageable, we stopped fighting hard on prevention. More and more people are getting infected. So we need to bring back urgency to find a cure or to find a vaccine for AIDS. So we are in this also to bring back the urgency to end AIDS. Those are the reasons we are here. Let me ask you a question too.
Please.
COVID has disrupted all of us. I sense that private philanthropy is also experiencing a disruption. This is a time of disruption. It can't be business as usual for philanthropy. Is this a moment of opportunity for you? Should we be reimagining how healthcare is governed and delivered? What could a reimagined healthcare system mean for the right to health? What are you reflecting on?
You know, Winnie, there were so many incredibly poignant things that you just said in your first intervention. One thing that I'll highlight is your notion that this is a moment when the rules have to change. You and I understand, and UNAIDS knows, and the OSF network appreciate that the rules have never really worked for the most susceptible communities, for the most vulnerable communities, and there's been a disparity in how those rules are applied in global north versus global south dynamics. So I am absolutely resolute that this moment cannot be a business as usual moment for philanthropy, Winnie. For the first instance, we have to ask ourselves relentlessly, who is it that we are in the service of, and what is it that we hope to accomplish in partnership with community? This is a moment for us to determine how we use our private financial leverage to bring the most vulnerable people into the mainstream of public welfare. That's why one of the very first things that we did in the Open Society Foundation was to provide direct, immediate financial relief to the most susceptible workers, immigrants, communities affected by COVID-19 when it became a global pandemic. In the global arena, we have taken it as our first principle that we must always and in every instance work to support civil society's instincts to hold governments to account, to hold global health financing institutions and donor governments to account for their commitments to right to health. As institutions and governments go through disruption, Winnie, we have to go through disruption as well. But as you suggest, that disruption can't just be about reacting with the fierce urgency of now to the crisis. We have instead to look at the long-term opportunities that emerge from the crisis, to work at transformation, and to understand that what COVID has done in this moment, Winnie, is to reveal disparities that have long festered for generations in all of our society. So it's an opportunity to completely reimagine not just healthcare in silo, but the entire suite of what it means to have a more broadly shared prosperity in the delivery of all of our services in order to build inclusive and vibrant democracies, true democracies, and to finally make good on the right to health. We have to appreciate, Winnie, that the right to health is the fundamental cross-sectional right that all other rights depend on. Nothing has revealed that in starker times than COVID, which has shocked the public consciousness and what it's done beyond the healthcare outcomes and its impact on economies. We appreciate the relationship between being able to mitigate the results of COVID with having access to clean water. So there's an environmental element. There's a way that social distancing is impossible when some of our populations are compelled to live in areas of intense density, shared spaces because of a lack of affordable housing. So that element comes into play as well. So the healthcare crisis reveals all of these other challenges. As you noted, public investment supports 100% of vaccine R&D. In real terms, Winnie, the people have already paid for this vaccine. When you consider that the U.S. and Europe have already poured $4.5 billion today into vaccine R&D. China alone has poured close to $2 billion into R&D. These are all taxpayer resources, and we need an accounting that's transparent and equitable. So this is a historic moment for us to collectively act differently, respond differently, transform medical R&D, take up questions of economic justice, but it also really compels those of us in philanthropy to understand that we don't have the resources on our own to do what governments can do, but if philanthropy acts in partnership, in concert, instead of in competition with one another, then we can leverage our advocacy, leverage our sense of values, and bring some much needed directional pressure on inclusion in this moment. As you can see, Winnie, I'm a little fired up about what the opportunity presents here, and I know that you are as well. Winnie, one of the reasons why I was excited for the Society Foundation to lean into this moment is because the People's Vaccine Campaign expressly calls for vaccines, diagnostic tests, treatments to be provided free of charge to everyone, everywhere. Can that actually happen? Why should the wealthy not pay? And what's the response that you give to some who say, the only way we'll get a vaccine is if we have the incentivized structure for the private sector to invest their resources. How do you respond to this, and why should the wealthy not pay for a vaccine?
You know, crisis can be a great opportunity, and this is where I see it. Because first, the model for producing health technologies and the model for healthcare has been a flawed one. And now it has collapsed. It has collapsed because of the crisis, and we can't keep the same. It's madness to stay with the same thing when it's collapsed. The model where research and development is led by pharmaceuticals, and then they use monopolies, intellectual property rights, to hike prices and keep them where they want and let people die while their profits come in the way. This is the model that has collapsed. Today, millions, billions of public money has been pumped into finding tests, treatments, vaccine for coronavirus. It's not the pharma money now. It's big money from governments. It's public funds plus philanthropy funds that are doing this. So we're saying, this is what we are asking for in the people's vaccine. We're saying that let technology, let the knowledge, the data, the know-how, the intellectual property be put in a pool. The WHO-led COVID-19 technology access pool. We want all countries, all governments to line up behind and support this pool, because in this pool, we will have all the technology, the know-how, the data shared so that we can accelerate innovation and reach as quickly as possible a vaccine or treatment. Two, we also have an opportunity to share the license openly without secret deals of pharma, so that in every region we can have production and every region is served at the same time with a vaccine. And then that also in the distribution of this production, we prioritize our health workers who are at most risk. We prioritize people with comorbidities who are at higher risk, not taking up all because you can buy and taking it to vaccinate those who don't need it in rich countries, but that we all share and we prioritize certain groups first. That is the whole idea behind a people's vaccine. That then the costs of R&D are transparent. This is public money. We must know what it costs. Pharma must take their cost, recover their costs, and then the price is brought down for buyers, governments, and private, and then for the end user, it is free. So this is not impossible. It's a model for the future, and we are insisting that this is the time for it, because anyway, the pharma model of intellectual property, profits coming before lives, has failed. So that is what we are calling for. And it's possible. With leadership, it is possible. And with public pressure, we can do it. I love moments like this. This is the time when what we've demanded, you as open society, we from civil society and from the UN, what we have dreamt of, what we've asked for, what was put as impossible, is now what's possible. So I wonder whether you have been yourself following, because even though we have pushed for people's vaccine and we even got governments to speak our language, they don't walk the talk. They talk about a global public good, but we are hearing and seeing vaccine nationalisms, buying up secretly, making deals with innovators, and hoarding and booking out future vaccines. Have you been following this? And do you have a comment to make about this inward-looking trend that is counter to what we are looking for? And how can we link a vaccine, a people's vaccine, to racial, to gender, and to economic justice? Because we've also seen these injustices.
Winnie, you ask the easiest questions in the world, don't you? this is challenging. I have to say first, though, Winnie, that I'm inspired by your hopefulness. I'm inspired by your optimistic, aspirational sense that we can indeed get this done in this difficult moment. Look, this is the hardest thing that any of us have ever experienced. When you consider that 90% of the global economy froze, all of us sheltering in place, when we appreciate that there are more than 10 million infections in the world and 500,000 individuals have lost their lives. In the country that I'm in right now, the United States, we've had over 120,000 deaths. We're on course to have over 200,000 losses of life by the end of September. And we have over 45 million Americans right now that have lost their jobs as a consequence of this. And that's just one nation. I highlight that one nation, though, because of the extraordinary resources that the U.S. has to respond, and the resources that it has to apply and invest in remedy and prescription. It's terribly important that Americans, that Europeans, that Chinese appreciate that all of us right now are in this boat together. And we can't get out of the boat and onto dry land if all of us are just kind of bailing out the water in our own little section, because our section is going to continue to fill in. There's an interdependence that has been evident as one looks at the way this disease has spread and the way that it's had profound impact on all of our economies in one fell swoop. We have this interesting dynamic where in much of the global north, there was first an experience with disease impact, and then eventually economic deterioration followed. In the global south, in much of the global south, the inverse was true, where as a result of the challenges that we have in our supply chains, challenges that we have, the pressures on commodities, the pressure on travel, tourism, etc. At first, in many places in the global south, we saw the economic impact first, and now we're beginning to see the extraordinary healthcare impact on the African continent, in Latin America, and more parts of Southeast Asia as well. We have to understand the interrelationship between these things, and we have to appreciate that kind of nationalism in our response is a kind of vaccine sovereignty that's not going to help anyone at all in the long term in our recovery, particularly as this is a virus that has already demonstrated that it occurs and comes in waves. If we want to manage this in waves, we have to manage this in ways that cuts across borders and relies on the instruments that we have for regional cooperation, for multinational intelligence gathering and sharing, for scientific cooperation, and for investors that appreciate and recognize the core humanity of us all. There's we can't afford in any country the kind of attitude that I've seen in my country, the American first attitude, where we think we just kind of build a moat around ourselves and lift up the drawbridge and be safe. We won't be able to recover economically and certainly not in our healthcare either. You asked me about how this is connected to issues of racial justice and what I'm hearing from communities on this issue. One thing that I can say, and one thing that's evident in the challenge that we've had around issues of policing during quarantine, for instance, we know that there's no vaccine whatsoever for racial injustice. There's no vaccine whatsoever for white supremacy. There's no vaccine for the remnants of colonialism and that legacy. There's no vaccine until we address these issues in systemic ways. That all of the biomedical advances in the world will get us no closer to the path towards justice. In the U.S., African Americans are dying from COVID at 3 times the rate of white. People of color are consistently denied or have access to healthcare. Our communities have proven to be the essential workers who create skilled choices between their livelihood and a lack of social net. You and I, Winnie, have the privilege that in these challenging times, you can work from home. But there are so many others who have to get up and go out to work in order to be able to maintain their actual homes. The current protest movements that we've seen in the U.S. and that have been joined up in acts that profound solidarity globally are revealing that there's a relationship between one kind of violence and another, one kind of comorbidity and another, and that by commodifying the vaccine in this moment, we would simply be reinforcing a system of economic exclusion that's contributed to making Black people the world over more susceptible and more vulnerable to this disease. And finally, I'd say on that issue, Winnie, that it's totally important that in the continent that I love so dearly, in Africa, that we move from a phase where African peoples are completely reliant on donors for vaccine handout. That absolutely has to end. I know you feel passionate about that as well. We have to reject this nonsensical notion that African governments can now proudly and competently redistribute resources to provide for their own people and be equal partners, not just in solidarity, but in the means of production to turn around this terrible scourge now and to be able to prepare prescription for illnesses in the future. So if I can, Winnie, I'm going to try to sneak in one last question to you as you bring us to some closure. I want you to just, again, for me, reiterate your optimism about this moment around specifically the right to health becoming a reality. Beyond just the question of the vaccine, but the broader journey that you're on about healthcare being a fundamental core central human right.
Thank you. Absolutely. If I can use the words of Secretary General Guterres, he said that no one is safe until all of us are safe. That is what we're learning from COVID. If anybody ever had any doubt that everyone has their right to health and healthcare is fundamental, is something that every government must provide, this is the time to wake up to that. And it can be achieved. We see the countries that had public provision of quality health care, social protection for their elderly, for their disabled, for vulnerable groups, they have done well, they have done best. They've been able to prevent, they've been able to treat. Look at the countries that have made it an issue for selling. Health is a commodity and they just sell it. They are struggling. And those which didn't invest, like our countries in Africa, which were prioritizing building infrastructure before the health of people, are also very vulnerable today. So then we have the examples of developing countries that prioritize the right to health, invested in it, public funds, countries like Thailand doing very well. So the lessons are there and I'm optimistic. We can learn them and we can take them forward. And I want to invite you, Patrick, to say a few closing words and to thank you so much for this dialogue we've had.
Well, Winnie, again, all thanks and appreciation for your value-centered leadership and the work that UNAIDS is doing. But as I close, I want to take up your spirit of optimism because I have such confidence in partners like Public Citizen, the European Alliance for Affordable Medicines, Universities Allied for Essential Medicines, Oxfam, your old home, and of course UNAIDS, but also the People's Health Movement, which is creating stronger joints between activists in Asia and Africa and Latin America in this profound moment. I just close by insisting that all of us are going to work together to demand that the global community act justly and fairly in ensuring access to life-saving vaccines and medicines today, and invest in people-centered, resilient healthcare systems for the future. Thank you so much.
Thank you, Patrick, and bye-bye.